All right. Thank you to everyone for joining us for the Scholars Trek panel on nursing. We've got 4 wonderful colleges today who are joining us on the panel. There. We've got Mercer University represented, Florida Southern, Iowa University, and the University of San Francisco. Panelists, thank you so much for being here. We know that each of your schools offers very unique and far-reaching programs in the field of nursing, as well as many other areas, and we're excited to share this information with our viewers. Viewers, following the panel discussion, we would encourage each of you to visit the college's virtual booths within Basecamp and to learn more about these schools and to get connected with their admissions team. And with that, we will get started. So what I would like to do first is just ask each of you to introduce yourselves, to share a fun fact about your university or highlight something about your institution that sets you apart from the others. And we will start today with Florida Southern.
Thanks so much. Hi, everybody. My name is Joe Madigan. I serve as the Director of Undergraduate Recruitment and Outreach at Florida Southern College. We're located in Lakeland, Florida. One of my first fun facts I always like to mention about us, we are one of the closest universities to the Walt Disney World Resort, about 30 minutes away from the Walt Disney World Resort. We're also recognized as the #1 most beautiful campus in Florida and in the top 10, once again, for most beautiful campuses in the nation for Florida Southern College. Home to just about 2,800 undergraduate students and about 3,500 total students. As we're talking about nursing, a related fact to nursing, students can go all the way up to a doctorate degree at Florida Southern College.
That's great. Thank you so much. All right, now let's go to Iowa.
Good afternoon, everyone. My name is Lacey Patterson, and I am one of the assistant directors at the University of Iowa. I actually work regionally, and so working with Southern students is what I do. At the University of Iowa, we are a member of the Big Ten. We're part of the not only the athletic conference, but the academic alliance as well. We're a school of a little over 32,000 total students coming from all over the United States and all over the world. So that makes it really exciting that students come together to live and learn at the university. Being part of the Big Ten, it does make it a fun atmosphere as well. Everyone is in black and gold and go Hawks and has that strong Hawkeye family to that. Strong areas of study. We do have over 200 areas of study at the University of Iowa for undergraduate students. So there's a lot of diversity in what our students come for. I know that today we're talking about nursing. So I do want to share that we do have one of the top world-class medical research centers in the nation. We have 3 hospitals on our campus. And so students have tremendous opportunities to get experience at the University of Iowa and also have a good time as well. So thanks so much.
Thank you very much. Now let's go to Mercer.
Happy to. My name is Jenna Palmer. I serve as one of our associate directors of admissions and recruitment for the Macon residential undergraduate experience. And I'm also a double bear. So that means I did undergrad and grad school. I'm committed now that I work here. So glad that you're joining for this panel today. A fun fact about Mercer. So I would say with our nursing program, it is the oldest nursing program in the state of Georgia. And then in terms of overall the Macon undergraduate experience, I call us a medium-sized campus. It's about 3,500, so not massive, not itty bitty, but you do still have access to those Division I athletics. There's 18 different men and women's sports that you can check out and go be a part of the Mercer community.
Great, thank you very much. And now University of San Francisco.
Hello all, my name is Milford Miles. You can call me Miles, that is perfectly fine. I am one of our assistant directors for undergraduate admission here at the University of San Francisco. A few exciting things about us, I would say, is our campus is located about a block from the exact center of the city. Students actually have residential halls where you can see the Golden Gate Bridge through your residential hall window, which is awesome. And I will also highlight, we are in a 2-way tie for the most diverse university in America, which is something we're extremely excited about. We have about 6,000 students in total. When you include our graduate program, it's going to bring us to about 11,000 students in total or so. I'm very excited to be here today.
Thank you very much. All right, so now let's talk about how students get started in the nursing program. Is it something that they apply to when they're applying to college, or do they enter the program after they enroll? And we'll start this round with Iowa, please.
All right, thanks so much. At the University of Iowa, we do recognize the November 1st early action deadline. This is a non-binding deadline, so that's good to know. We have two pathways. The first is direct admission, and so those are for students coming out of high school who are hoping to gain admission to the University of Iowa's College of Nursing. You first apply to the University of Iowa by that November 1st deadline, and then you must meet the academic criteria to be invited to apply then to our direct admit nursing. We admit 80 students a year into our direct admit nursing program. And so there's the first process, which is our early action deadline. And those are going to be, we're going to admit 50 students into that. And then we do our regular decision, which will be 30 students from the students who have applied after that. We do have a we do have a standard admission process for students who are currently enrolled at the University of Iowa, and we also admit 80 students through that process. We do have a number of programs that are set up to help students who are hoping to gain admission to the College of Nursing as currently enrolled students. So there are two pathways, and we will help students figure out which one's the best for them.
Great, thank you very much. Let's go to Mercer.
Okay. So with Mercer University, we offer a pre-nursing coursework. That means whenever you apply to Mercer University as a high school senior, you're applying for our pre-nursing pathway. That is for your first 2 years with us. As long as you do well academically, you can continue on and apply to our Georgia Baptist College of Nursing. That's located just an hour up on our Atlanta campus, and able to move up with that nursing cohort and continue on at that location.
All right, thank you. Let's go to USF.
Great. So we do have a direct entry pathway. So of course, students who are in high school are able to apply directly to our nursing program. It is just going to be one application. So when you're working on that app, you just select nursing as your major. And if you're admitted from day one, you are in our nursing program, immediately taking nursing classes. Something to be aware of. It is impossible for any USF student to switch into our nursing program, right? If you are a nurse and want to switch out, you're more than welcome to do so, but switching in is going to be impossible. And we admit about 120 first-year students every fall.
Thank you. And Florida Southern.
I can actually echo a lot of the things that Miles had mentioned for Florida Southern College. Florida Southern College is a direct entry, direct admit Bachelor of Science in Nursing program, BSN. So students will apply not only for admission to Florida Southern College at the same time if they select nursing on their application for admission, whether that be through the common application, our own institutional application, or the coalition score application, they're automatically going to be reviewed for a seat in the School of Nursing, starting nursing classes their first semester, their first year, clinical hours starting the second week of the sophomore year. We do not allow internal transfers or external transfers into the School of Nursing at the undergraduate level. So it would only be high school seniors that are allowed to apply for the School of Nursing. We have 100 seats in our BSN program starting the first year. Generally, we'll admit 100 to 160 to 180 students for those seats. They go very quickly. It's first come, first serve. The students raising their hand after they've been offered admission to Florida Southern and a seat in the School of Nursing to accept that seat. We strongly encourage students interested in the School of Nursing because of the popularity and the strength of the program to apply through our early action or early decision pathways. November 1st is the deadline for that, or our regular decision 1 deadline to apply to Florida Southern by is December 1st.
All right, thank you all very much. All right, so for the students who are maybe not sure if they really want to pursue nursing, and I know some of you have answered this question, but for those of you that did not, is there a way that they can get in there later on, or perhaps a path that they can choose that would set them up to be successful in a nursing program? So we'll start with Mercer and just go through.
Yes, the answer to that for us is yes. So for a lot of times, students are coming to us with a strong interest in the health sciences overall and may not know exactly which pathway is going to be the best fit, right? Part of it is you want to go experience the classes and see which one. One of the benefits with how our program is set up, a lot of our pre-health, pre-professional tracks overlap with one another with the coursework you're able to take that first semester. You're also going to work very closely with your overall academic advisor and your pre-health, pre-professional track academic advisor. So think of it like a support team to help you as you're navigating and seeing what's ultimately going to be the best fit for you. For some students, that means coming in undecided as an overall major on a pre-nursing, pre-professional track and working very closely with your academic advisor to let them know you may not be 100% confident just yet, and you want to craft a plan to help you be successful. So yes, there are those pathways.
All right, thank you. We're going to go to USF, and if there's anything you'd want to add.
Yeah, of course. Of course, it's kind of like a gift and a curse in regards to the direct entry process, right? Students know that they're going to be in the program once they're admitted. But unfortunately, students will have to know by the time that they are applying if they want to be admitted to our nursing program. So definitely really think about that. And you're more than welcome to reach out to the admission office at USF to have a more in-depth conversation to see kind of what works best for you. I will say, however, that we do have a transfer process for students. Of course, no current USF student is able to transfer to our program, but if a student outside of USF would like to transfer in, definitely possible to do so. So note that that's a possibility for students.
All right, thank you. We'll go to Florida Southern.
And with us at Florida Southern, I think one of the things that I'd like to reference is if you're unsure if you want to pursue nursing or not, for us, one of the best ways to determine that is first and foremost, if you have any interest in nursing, we do advise students to apply for nursing as your major on your application for admission first and foremost. Following that, we have very extensive open house programs called Southern Showcase. We also have very extensive admitted student days called Southern Select, where students actually get to spend a day in the School of Nursing in our Blank Nursing Laboratories on campus, working with the simulation labs, talking with our professors, understanding what it means to be a nurse. And another way you could do that too is through a career services office to determine if that's the right fit. If it's not the right path to pursue, if a student's interested in health science programs of some kind, medicine, maybe they're interested in a PA school, physical therapy, we will work with a student because that's something also, again, we're very well known for and well versed in, is the health sciences here too with 100% acceptance rate in a medical school. So sometimes that can be difficult to determine as a high schooler, if you're 16, 15, 16, 17 years old, knowing that that's the path that you want to go down. My first thing is to say, go ahead and apply nursing if they have any interest in that based on what we're looking for, and then we can guide you if that's not the right fit for you as a student.
All right, great, thank you. Let's go to Iowa.
Yeah, so at the University of Iowa, we do have a standard admissions process, which is for currently enrolled students and transfer students to the University of Iowa. We do admit 80 students through that program every year. And so we, if you're coming in as a first-year student and you do not get directly admitted into the College of Nursing, the College of Nursing does host a number of workshops and support programs to help students become academically eligible to apply for the College of Nursing. Also, at the University of Iowa, with having such a strong health sciences atmosphere, students really get to learn about if health sciences is where they want to go. We do have a medical school, dental school, pharmacy, physical therapy, public health, global health. We have 3 hospitals on our campus. Students have access to do research and to become engaged in that process. So it really helps students decide what they want to do. I've worked with a number of students who were not directly admitted to nursing, and then they found out, you know, they came to Iowa and learned, and they were able to gain admission through the standard pathway. And I had other students come in and figure out that maybe nursing wasn't the right pathway. And I think that was echoed through with everybody else on this panel, that coming, no matter where you go, there's a lot of support. It's about asking questions. It's about realizing that we want to see you be successful wherever it is that you want to go.
Okay, thank you very much. There. All right, so, you know, how does your school prepare students in academic areas that traditionally fall into professional tracks that are maybe more specifically focused, like, do you do physical therapy, those types of things, and some of those other health related science or health science related careers. Let's go with USF for this round.
Yeah, of course. So what I can say is included in our nursing program, starting a student's sophomore year, we start placing them at different clinical rounds, right? And they will do a clinical rotation, one every semester, and it will be at a different location. So one way to kind of introduce students to the different environments that they will be at is really going to be through those clinical rounds, right? Initially, students will be starting at like a convalescent home, right? Really to understand how to talk to patients, how to change a bedpan, how to change bedding on sheets and things along those lines. As the curriculum increases, so does that level, so does the kind of focus of where students are going to be on. So changing from med-surg to pediatrics to neonatal and things along those lines. So it's psychiatric as well. So a student may come in and say, I want to be a pediatrician. I love working with little kids. That is my dream. That is my heart. And maybe they might work at that psychiatric clinical round and say, you know what? I really have a desire to work with this particular population. So one way that students are really getting that experience is through those clinical rotations that change every semester. And of course, the final semester on our campus, students will be doing their capstone. Well, they get to pick where they want to spend their final semester at, right? Looking at all of their experience, they'll select what they would like to do and do their capstone in that particular space. So that variety is really going to be built into the clinical rotation schedule that we have.
All right, great. Let's go to Florida Southern.
This is great to go right after Miles, because I can just say ditto to everything he just echoed as far as the curriculum, the setup, especially for our nursing students. Likewise, second week, sophomore year, they're going to start going into clinical rotation experiences. And I'll reference as well, preparing students to go out into that environment would be working in our simulation laboratories on campus. We have 17 different simulation mannequins, from birthing nursing to pediatrics, OB. So whatever it may be that a student is interested within nursing, they're well prepared and have to actually log clinical clock hours within our Blanton Nursing Laboratory right on campus. So they're not having to leave campus for that practice right off the bat, gets them comfortable in a real life situation. What happens when someone codes? What happens when someone instantaneously is going into birth in our simulation laboratories? These are full-fledged, life-size human mannequins that they're going to work with. That's there, giving them that hands-on exposure, and then getting them out into those clinical rotations. It's sometimes called internships, and that spreads across all other areas. And when I talk about kind of the different types of professional spaces, business, nursing, our pre-professional tracks, pre-medicine, dentistry, pharmacy, physical therapy, I should really reference our career services office here at Florida Southern, recently ranked by the Princeton Review number 24 in the nation overall. They actually start working with students in March of the senior year of high school to see what the students are most interested in with strong interest inventories, giving them the opportunity to understand what does it mean beyond just having classes to build a resume, to be a competitive applicant, no matter what field that you go into, how to be a good interviewer, how to be a good speaker or writer. All of those skills are built throughout our career services office. We have 14 career services professionals that work with each one of our individual schools and colleges here at Florida Southern College, directly with the students within that.
Great, thank you. Let's go to Iowa.
Yeah, at the University of Iowa, students who are directly admitted into the College of Nursing, they start learning and working in the College of Nursing day one. We have an 8:1 faculty to student ratio for students who are in our College of Nursing, so they're getting direct and hands-on learning opportunities. We also have a state-of-the-art nursing clinical education, nursing clinical education center, forgive me. And so the students are coming in and they're learning about complex nursing situations, and they're being engaged in clinical situations right away. Also with our cooperation and our partnership with University of Iowa Hospital and Clinics right now, they're world renowned as one of the top teaching hospitals in the world. So having that accessible right on our campus, literally across the street from the Nursing Education Center, provides really outstanding hands-on learning opportunities for our students. We really believe in the educational process, the technical process, the student engagement that goes through with our training our nurses and what they're able to accomplish once they leave the University of Iowa. And so overall, I feel that students who come to Iowa have a tremendous opportunity just being right in Iowa City and right out on campus at the University of Iowa.
Thank you very much. And now let's finish up with Mercer.
Happy to. So something that we offer that is a little bit unique is with Mercer University, we want for our students to be global citizens, right? Be able to have an impact on the world and the community. That can be your local community, but a way that we really address that global aspect is with our program, Mercer on Mission. So with that, our students with the support of faculty are able to go abroad to another country for 4 to 6 weeks, address a clear identified need in that population. We have one specifically geared towards our undergraduate nursing students, as well as our master's and doctorate level nursing students. So they're able to go provide this service. Some of them include wellness children checks for students within the schools in that area, health education for students, first aid training, coursework for the teachers. So you're getting that hands-on experience and you're also earning college credit whenever you complete it. So something to keep in mind.
Great, thank you. All right, so let's come back a little bit to the nursing classes and how big or how small are your nursing classes on your campus? We'll start with Florida Southern.
Yeah, with being a cohort of 100 students that would start in our first year cohort, we're going to split that into 4 or 5 cohorts within that. So your initial classes are going to be either 20, 25, or you may have what we call a lecture hall of 50. Still hard to hide in a class of 50 that's there. Lots of personalized attention. All of our classes are also taught by full-time faculty or full-time practicing professionals. That should be important to note. The biggest class that a nursing student will ever see is that 50. The smallest class that you may have would actually be in the clinical laboratory spaces where you could have classes as small as 4 or 5.
Okay, how about Iowa?
Yeah, at the University of Iowa with our cohorts being small as well. So the actual nursing courses are going to be pretty limited, from even one-on-one coursework with your faculty to having larger classes of maybe 20 or 25 when you're actually in the nursing cohort. You may have some larger classes if you are taking some general education courses, or if you're expanding your reach in terms of what you're going to learn, or if you're learning another language. You may have classes, like 80% of our classes at the University of Iowa are 30 students or less. And so students are able to get a quality experience at the university while still being able to have access to their faculty.
Thank you. Let's go to Mercer.
I don't want to say ditto, but very similar. So the entry-level coursework, those sizes that we're referencing are going to stay fairly similar to what has been shared already.
All right, thank you. And USF?
Yeah, very similar as well. I would say entering into the nursing program, those nursing courses will be around 22, 23 students or so. Of course, GE courses will be a bit larger. Now, when students move into those clinical rounds at those hospitals, they will be around 10 to 12 students. Now, that will lead all the way up to your capstone, where students will be one-on-one working with an advisor, kind of running the floor and calling the shots. So it varies greatly.
Thank you. All right. You know, you talked about sort of those experiential things, but let's talk about what kind of facilities you have on your campus. So Iowa, if you would start and just explain some of the special things that you have on campus specifically for nursing students.
Yeah, the main facility would be the facility I referenced earlier, is that nursing clinical education center that's available for students to allow for those allow for hands-on experience before you're actually in a hospital doing patient care. It provides students complex situations that they may run into, and then gives students that ability to be prepared for clinical situations that they may have within the University of Iowa hospital and clinics that are at the University of Iowa. So students do have access then to work at the University of Iowa hospital and clinics, where we have our traditional hospital, we do have our Steed Family Children's Hospital, and then the state of Iowa's Veterans Hospital is also on our campus. So those are just the beginning, you know, of where students are getting experience at the university.
All right, thank you. Mercer?
Yes, so we have something, it is called the Science and Innovation Quadrangle. So with that one, that is really the setup for all of our science-based buildings. That's where labs will be hosted. That's where classes are going to be hosted. And that's where you really get access for that hands-on experiential learning piece for it.
Great, thank you. Let's go to USF.
Great. We have two specific facilities for our nursing students, right? We will have one, which will be our simulation center, right? This is a space that's really set up like a hospital room, right? We have one of these really cool high-tech mannequins that are able to talk, cry, give birth randomly, right? And in this space, students are really going to be understanding and practicing what it's like to kind of walk into a room and start triaging a patient. There's also two-way glass, so your fellow cohort's going to be on the other side kind of watching you. Of course, that's a bit nerve-wracking at times, but of course, after the exercise is over, you're able to debrief it with your fellow colleagues or your fellow students. We also have a skills lab where students will be learning some of the hard skills in terms of how to input a catheter, injections, things along those lines. So both our simulation and our skill lab are available specifically for the nursing students.
Whoops, let's go to Florida Southern.
Thank you. And very similar to what we're hearing from colleagues here, we have the Joe K and Alberta Blanton nursing undergraduate facilities. We've had to rename it as the undergraduate on-campus facilities, as our graduate students now have their own facilities off campus as well. So our second facility that just opened this fall, an additional 35,000 square foot facility on top of our 39,000 square foot facility on campus, home to some of the most advanced simulation technology for medicine you're going to find. Treatment laboratories are big work opportunities for students with the high-tech mannequins as discussed. They can speak, hear, respond, physiologically reproduce true life situations for students. Having the opportunity again to do that in a two-way environment with the two-way glass. We also video any of those actual practice opportunities for students so they can see, analyze, assess, and then reassess how they would handle a situation in the advanced simulation technology environment to really master bedside care in the controlled environment that's on campus that's here.
Wow, that all sounds pretty amazing. What great opportunities for students. All right, so are there any special research projects that are related specifically to nursing that students can get involved with? We'll start with Mercer.
Happy to. So with this, I will say that Mercer in general, we are very much so a place where we want students to have access to undergraduate research. That absolutely happens for our seniors and our juniors, and also happens for our sophomores, and in some instances, our first-year students. So with it, I would encourage students to check out Bear Day. It is Mercer's research symposium. Students from any discipline are able to present research findings, and that is something they get access to very early on in the process. And at this point, over 50% of our undergraduate students are able to participate in research. So that's just something to think about.
All right, thank you. Let's go to USF.
Yeah, so for our nursing students specifically, unfortunately, there's not really research opportunities available, right? Again, because our structure, the nursing program is so intricately structured that students will not have much time on top of their clinical rounds, their nursing courses, and maybe even additional jobs that they may have to do research. So a lot of the energy and focus of our students is going to be in those clinical rounds, practicing your skills and doing your normal GE courses. So unfortunately, many of our nursing students don't do research aside from those clinical rounds.
All right, thank you. Florida Southern.
One of my favorite topics to talk about, Florida Southern College, often recognized as a top research institution, and this really goes heavily into the nursing department here. Students at the end of their nursing program and curriculum can actually complete, if they are interested in doing so, basically a thesis project. We had 12 students published this year for their theses and work that they completed. I'll reference a few of those students, like Annalise Fernandez, in her research and overlooked and undiagnosed paternal postpartum depression. One of our students that was recently actually quoted, notated in research that was published in the Modern Medicine journals would be the isolation correlation in the NICU of parents and infants following the COVID-19 pandemic. And it just shows the endless opportunities from students that are interested in studying the effects of health on learning and learning on health. We are one of the few schools in the nation that actually our nursing students have direct research opportunities starting the first year to study this within our School of Education, as our Blanton School of Nursing and our School of Education on campus directly work together to study the effects of health on learning and learning on health. And that research is published each year.
Wow. Iowa.
Yeah, thank you. The University of Iowa does have robust research opportunities for students all throughout the levels. We are considered a Tier 1 research institution. 1 in 3 undergraduates are engaged in research at any given time at the university. Currently, our College of Nursing has over $6 million in grants and research opportunities at the university just within the College of Nursing. Undergraduates are encouraged and supported to be part of our research that's going on as well. I know that I'm not going to be able to memorize all of the opportunities that are available, but students can work, whether it's through the University of Iowa Hospital and Clinics. We have a strong SIM project that works with rural Iowa, providing healthcare throughout the state of Iowa that's available, especially with our nurses, and to be able to provide that care. We're working with pain studies. We're working with studies that is involving, I'm trying to look here and cheat a little bit with what we're able to get, but the different areas that students are able to gain access to. So I think it just really depends on what the student's interested in and learning about in terms of their research, and they're able to get that sort of access when they're at the university as well.
Great, thank you. All right, let's talk about after graduation. So how do each of you assist students with their post-college plans? And that can be either with career placements or graduate school, or just whatever happens next, and maybe share some of the organizations, the companies, the healthcare institutions that come to your campus to recruit. So if we could start this round with USF.
Of course, yeah. So first, starting off with just our Career Center. When I'm talking about our Career Center and the opportunities available around our campus, I am not going to do it justice in regards to the level of support that our Career Centers are providing for our students. Of course, students are able to regularly interact with our Career Center on a regular basis. And even after graduation, students are still able to interact with those spaces, right? We, of course, know once students graduate, they still have to sit for their in-class and whatnot. So when students pass all of that, they are able to continue to work with our nursing program, our Career Center, to kind of help you along the lines there. We also have graduate programs available for nursing students too. So if you are interested in doing that, you're able to continue to stay on our amazing, beautiful campus. And of course, we have a 4+1 program for those who already know that they want to get that graduate degree. They are able to work on those graduate courses at the same time they are working on their undergraduate courses. I know one of our students graduated about 2 years ago, Nicole. She was a rock star of a student, worked in our admission office as well as in the nursing program. And immediately after graduation, she was able to go back home to Sonoma and work as a pediatrician at her dream hospital where she was actually born as well. And she definitely attributed this not only to the support of the Career Center, but the connections with the nursing faculty that were on our campus as well.
All right, thank you very much. Let's go to Florida Southern.
I'll throw a couple of statistics out just as far as post-college plans. Our outcome rate, so post-graduation overall for Florida Southern College this year, is 95% of students achieving their post-graduation goals. And that could be going into military service, which, as we're talking about nursing, we're one of the top Army ROTC nursing programs in the country. We have specific scholarships through ROTC if students are interested in becoming an Army nurse. It's a very unique program through Florida Southern in our on-campus program. If it's post-graduation goals that students are working towards in the field of nursing, 60% of the clinical site locations where students actually completed their clinicals are offering jobs to students, and we have 100% placement of our nursing students post-graduation. We actually host a nursing fair, so employers can come on campus, oftentimes bringing nice gift bags and asking students to look at their employment opportunities, whether that be Lakeland Regional Medical Center here in Lakeland, Florida, which is actually the largest trauma and ER unit in the United States now. Here, Orlando Health being in a major metropolitan area, Tampa General often ranked very heavily, Moffitt Cancer Center, that's students interested in that. And with post-graduation plans, this comes through some of those clinical opportunities. And one I'll even reference that you talk about dreams of students. One of our students, who was our student body president, Natalie Barton, in between her junior and senior year, had the dream of being a medical missionary nurse, had the opportunity to do so in the Philippines as a birthing nurse, was able to come back, bring those experiences back. Post-graduation, got a job working for Duke University Medical Center, which was her dream job. Up until now, she's actually now working as a medical missionary, setting up clinics because she had gotten her 4+1 nursing, Bachelor of Science in Nursing, and an MBA at the same time. She's now setting up clinics in Nigeria post-graduation from Florida Southern. And so it kind of shows the opportunities, no matter what students looking for. Our career services office is going to help students find those and invites the employers to campus to fulfill those actual post-graduation goals, whether it be going into grad school or going to the workplace.
Yeah, thank you very much. All right, let's go to Iowa.
Yes, University of Iowa students, whether you're a College of Nursing student or any student, has tremendous access to our career services, as well as they bring a number of employers to the University of Iowa every year. Last year, we had over 71,000 employers come to campus across all of our disciplines. So it provides really amazing opportunities for students who are looking at coming to the University of Iowa and what they're going to be doing afterwards. 96% of our students across all disciplines at the University of Iowa have a job or in graduate school or are doing their path after graduation. Within nursing, that's 100%. We do have over a 98% pass rate on the NCLEX, did I say that right, exam. And so our students are doing tremendous work at the university. Our nurses also have similar experiences that you've heard from everybody here. They're getting multiple job offers. And so people are coming to the University of Iowa seeking our nurses and giving them pretty much the package that they're hoping to desire. University of Iowa nurses, they get their Iowa pin, and that is a badge of honor. When you go into any hospital, you'll know that when you see that Tiger Hawk, people know where that came from and what that means and what that stands for when you're in the line of work. And so that's really impressive with what students are going through. Many of our students do go on to graduate level of study. We, like some of my colleagues here, we go through the doctoral level at the University of Iowa in nursing. And so some students begin their education, maybe start working and realize that they want to continue that pathway through nursing and making an impact in what they're doing, not only in the hospital setting, but also through educating others with what they're able to do with research and our future nurses that will be helping us for a very long time. So in terms of the support that students have, it's numerous. It's they want to support our students who are graduating, and students have many opportunities for where they want to go.
Thank you very much. All right, let's wrap up this question with Mercer.
Go ahead too. Very similar in terms of that 95% placement rate. That's across all of our undergraduate students. But in terms of the support that our nursing and pre-nursing students get, I like to talk about our Office of Academic and Advising Services, because they are very much so a resource that helps students at that entry level, as well as partnership with our Georgia Baptist College of Nursing. I'll get it eventually, but that one is located on our Atlanta campus. The partnership that happens is that our pre-nursing students get access and exposure while they are in Macon. So they get to work with the admissions representatives. They get to see what the college is looking for. They have that experience to know how to make their application stand out. And then once they're on the Atlanta campus and round out their nursing coursework, also very similar, there is a lot of potential and opportunity within the Atlanta area for our students. It's really trying to see what is the ultimate best fit for them and what they're hoping to accomplish, and how can we support them in doing so.
All right, thank you very much. All right, so now let's talk about what you're looking for in prospective students and what type of student thrives on your campus. So we'll start with Florida Southern.
With regard to what we look for from a student, first and foremost, I will mention that Florida Southern College is a test optional university. A student can choose to apply to Florida Southern College with or without test scores. They can choose to do so. And we look at a variety of different things in the application process. You often hear this as a holistic application review. And I'm going to be very specific more so and give some guidelines for nursing students. If a nursing student is applying to Florida Southern College, generally what we're going to be looking for is a bare minimum of a 3.5 weighted GPA from a student, as well if they apply with test scores, a 23 on the ACT as a composite super score, or an 1100 on the SAT as a composite super score. We also will look at an essay, letters of recommendation, involvement for the student. If the student chooses to apply test optional to Florida Southern College, a likewise 3.5 GPA weighted is the bare minimum. And then we want to be fair to our students to make sure that they're going to be successful and thriving in our School of Nursing. So something that we're going to be looking at is how students have done in their science classes throughout high school. The biology, the chemistry, the physics, the anatomy and physiology classes. We want to see how students have done in that if they're applying test optional to Florida Southern. Generally speaking, we're going to look to see a student has at least a 3.5 weighted, again, GPA in those classes, giving additional weighting for AP or honors or dual enrollment or ACE or IB, whatever it may be. And the type of student that thrives here at Florida Southern College, our retention rate, one of the things we're most proud of, almost 85% of our students retain each and every year, first year to second year at Florida Southern, and graduate on time likewise. And one of the reasons for that is we see students that come in out of high school with at or above a 3.6 GPA are going to do just fine, whether it be they apply test optional or test considered at Florida Southern College in the School of Nursing. They're going to do well if they've done well as a student in high school academically, and they're a good fit for the culture of our campus, wanting to get involved in other things.
Thank you. Let's go to the University of Iowa.
All right, so at the University of Iowa, we do have pretty transparent admissions policies for students to be admitted to the university. So first you apply to the University of Iowa. As I mentioned earlier, we do encourage all students who, especially who are looking at direct admission opportunities, to apply by that November 1st early action deadline to assure that they have the maximum opportunities. So for students who are looking at nursing, you first, like I said, apply to the University of Iowa and get admitted to the University of Iowa. And then if you meet the criteria, you'll get invited to apply to the College of Nursing. So the College of Nursing does have strict criteria that we will need to have. So students must have a 3.8 GPA or higher. You must have 4 years of English, 1 year of biology, 1 year of chemistry, 1 year of high school physics. You must have 1 year of algebra, algebra 2, geometry. You need to have 3 years of social science, and then 2 years of a world language. And so if you meet those criteria and you put down nursing interest, then you will be invited to apply to nursing. The big thing that we're looking at with the nursing supplemental application is that you complete the essays, be thoughtful about what you're answering. We're looking for students that can contribute to the College of Nursing and have a passion for lifelong learning. Students who should tell their own stories and experiences and relate that to how they want to be effective in the line of nursing. And so those are going to be really important attributes to consider when you're applying to the University of Iowa as a first-year student.
Thank you for sharing that. Mercer University.
Yes, we are also a test optional institution, but with this one to go in a little bit of a different route, the type of student that thrives on our campus. The students that are coming to Mercer, they're already academically inclined. We know that it is a focus and an intention behind what they're seeking, but the ones who are looking for service, who want access for leadership, as well as access for research, those are really the students that thrive in our environment, because that's what we want to make sure that they have exposure to. Helps make them more well-rounded as an individual, and also helps them stand out for their long-term graduate and professional school application process.
Thank you. All right, and let's go to the University of San Francisco.
Of course, at USF, we are what you would call a Jesuit Catholic university, right? So there are about 27 in all of America. Really important for us to bring that up. And I'll say, 27% of our students identify as Catholic, right? So if your faith is important to you, USF is an amazing space for you to grow spirituality. The other 73 either identify with a different faith or have no religious affiliation at all. The main reason I bring this up is really one thing that comes from attending a Jesuit university is this emphasis on not only education, but also social justice, right? Getting your degree is awesome. Look, I got my degree, let's party, celebrate. But really, how are you using what you're learning to impact your community? And that is the cornerstone of our institution, right? So we're really looking for individuals who are not just passionate about being a nurse, but also using that nursing degree to do something positive in whatever community that they're going to. And I would also say students who do well, we are in a major city, right? So usually students who are either one, a bit more adventurous and want to be in a space that's kind of a little bit more up-paced and fast-moving, are students who may not have never been in that type of environment before, but really have a heart and a desire to do so, definitely thrive well on our campus too. And we are as well a test optional institution, so something to be aware of as well.
All right, thank you. So what can students do to prepare themselves for success as a nursing student? Some of you mentioned just some general courses, but is there a particular level of course that any of you are looking for? And we'll start this round with the University of Iowa.
Yeah, that's a great question. So for the University of Iowa, I'm not going to go over the high school core courses that are required, but it's really making sure that you take those courses. I would say the largest holdup that I talk about nonstop is high school physics. For at least the University of Iowa, we have to have high school physics, and that's critical. If you don't have it, you will not have the opportunity to apply to our College of Nursing. So it's important to make sure that you have the high school core. If you have any opportunity to get some sort of shadow experience or any sort of ability to gain access to a healthcare system and just see if nursing or public health or pre-med or whatever it is that you want to do, because health sciences is one of those areas that it is helpful if you have some sort of just basic understanding and experience that'll help you just do better no matter where you go.
All right, that's some great advice. All right, Mercer.
I agree with that advice. So what we really encourage students is if you see that this is something that you want to go and pursue and you have identified that nursing is an area, see who you can talk with, see who you have access to. To us, it speaks volumes whenever students have the initiative and dedication to research the field that they are interested in and use what resources are in front of you. So if you can do online research within the program, do that. If you have access that you can shadow, do that, as well as look at the depth of your math and science courses that you have access to, where you can have additional rigor. To us, showing that you have the initiative and dedication to have that type of prep work and successfully challenge yourself academically, that shows us that you are going to be ready to take on the rigor of a full-time college setting. So again, use your resources, talk with different ones that you know, take advantage of any volunteerism, service, or shadowing opportunities, and successfully challenge yourself with your rigor.
All right, thank you very much. Let's go to University of San Francisco.
Of course, I would definitely say put a lot of energy and effort into your high school science courses, right? Particularly, I would say chemistry is one that we look pretty intensively at. So putting a lot of effort, energy into science, including chemistry. Definitely utilize any resources, if there are any available around you, in regards to nurses and knowing what it's like to be a nurse, right? Because we are a direct entry program, we will need students to know right away, hey, I want to be a nurse. Definitely utilize those resources if you have them available. And we also want students to reach out to us to really have those conversations of what it's like to be a nurse, what it's like to be a nursing student on our campus, right? So we do have virtual nursing events every month, one coming up in December 14th. You get to see me and then one of our nursing faculty members, as well as a current nursing student, and get your questions answered, right? We also have opportunity for students to give our office a call, or something we have called Unibuddy, where you get to chat regularly with a nursing student. So we really want our students to know what it's like to be a nursing student at USF and be able to have those interactions and conversations. So reach out to us so we can have those conversations with you.
All right, thank you very much. And we'll wrap this question up with Florida Southern.
I'll echo everything that my colleagues had mentioned here, especially science classes for us at Florida Southern, biology, chemistry, and meeting the science requirements for your specific high school graduation requirements. That's really, we're going to look for that. I'm going to even take this in the same direction more so that Miles had mentioned, in using the individuals on our campuses as a resource. Your admissions counselor is a great resource at any college or university to get more connected with the community, see what the college is looking for. And here at Florida Southern, each individual geographic area that a student is coming from has an admissions counselor. And then I'll echo back onto the opportunities to learn more about the specific program itself. Here at Florida Southern, we want you to visit. I think that's the best way to understand what it's like as a student here, is to see it for yourself, whether that doing a virtual tour of our nursing facilities, participating in one of our virtual nursing tour events led by Claire. She is one of our virtual student influencers, a student here in our nursing program at Florida Southern on ZME. That's an app you can download on your phone. It's ZEEMEE. You can follow Florida Southern there, and you know many schools are also on there. And then likewise, we do individual nursing events on campus. We have a program here called Southern Sunset. It's a sunset tour in Florida. What sounds better than that? And then having the opportunity to actually see our School of Nursing when it's active and lit up at night, both from our students and the lights on campus.
All right, thank you very much for that. All right, are there any nursing specific scholarships that your colleges offer, and what's the process to apply? Let's start with Mercer.
Yes, so with it, whenever students apply to Mercer, they are also automatically considered for any merit scholarship. One thing to note, our pre-nursing application process is different than application for the Georgia Baptist College of Nursing on the Atlanta campus. So with that, it means whenever you apply to that program on the Georgia Baptist College of Nursing campus, you are doing a separate application for tuition fees, and there is a separate scholarship consideration as well. So with it, there's more information related to it on the website. And if we are a Georgia resident, there is potential to receive some of that state aid and have it be applied towards those last 2 years there.
All right, thank you very much. Now we'll go to University of San Francisco.
Yeah, so similar, we have a merit scholarship available. All students are eligible once they apply. Something else we do have full tuition scholarship opportunities for students who identify as either Black or African American. For those, nothing extra students need to do. If they have a 3.5 weighted GPA, an invitation for that will be sent out immediately. And we also have 2 specific nursing scholarships that every newly admitted student is able to apply over the summer before college classes start. One of which, and students will get an invitation on how to apply for those, but one ranges in $5,000 per year. The other one ranges in $27,000 per year. And those applications are read by our nursing faculty as well. So those will be the main ones available.
All right, thank you very much. Let's go to Florida Southern.
Similar for Florida Southern College, students are automatically considered for merit scholarships at the time of admission, and that's regardless of major that a student chooses. Unique for Florida Southern, we are a scholarship stacking university. So what that means is students have the opportunity to be awarded a merit scholarship. And on top of that, they also could stack a nursing departmental scholarship called the Hollis Scholarship. That is determined as far as need goes. So the student would need to submit a FAFSA to Florida Southern and then also be admitted to Florida Southern and be considered for that. And then we have Prestige Premier Scholarships. These are application-based scholarships. We award specifically 1 per year for each one of our different scholarships to a nursing student. They go all the way up to a full ride. We have full tuition and various amounts of additional scholarship aid. Students can also stack Florida state-based aid, such as Florida Bright Futures or other aid, in addition to these scholarships, to making it very affordable.
All right, thank you very much. And University of Iowa.
Yeah, thanks. So at the University of Iowa, all students who apply for admission will automatically be considered for our incoming student scholarship. So that'll be based primarily on academic merit. We also stack our scholarships, so students do have the opportunity to receive more than 1 scholarship. We also have an underrepresented student scholarship that'll be awarded based off of your application for admission and also considering financial need. For the College of Nursing, we do have a handful of first-year scholarships. Students do need to apply early, and it's through our Iowa Scholarship Portal. And then once at the University of Iowa and in the College of Nursing, more scholarship opportunities do become available. We have over 90 scholarship opportunities just for nursing students at the University of Iowa. And so those opportunities become available through our Iowa Scholarship portal, which is for currently enrolled students at the university. So there are a number of opportunities. And then, like everybody else here, we all probably have financial aid counselors. So no matter where you go to school, wherever it is in the United States, make sure to reach out and ask questions about financial aid and about scholarship opportunities. And if you have questions about scholarships that you're bringing from your home, like maybe you received a community scholarship, make sure to reach out and ask the questions so that we can help you no matter where you go to school.
Great advice. Thank you. All right. How can students learn more about your campuses? Let's start this with USF.
Yeah, of course, the best way I would say is always to visit our university, right? We have tours regularly, Saturday tours as well. So that's for sure a great way to learn more about us. Beautiful campus, right? I would also say we have like admission appointments that all our students are really able to sign up for if you're not necessarily able to visit our campus. Ways for you to be able to chat with your admission counselor and get any questions that you may have answered. We have a virtual tour, which is spectacular, right? Super interactive. You even have a little tour guide on that tour as well. So a great way to see our campus. And yeah, those are, I would say, the main ways. Either visiting it in person, doing one of our virtual tours, are definitely the main ways to interact.
All right, thank you. Let's go to Florida Southern.
I will put a quick plug in. Visit Florida Southern College's Scholar Track Base Camp. That's there. It's got a lot of great information that's in there. Documents, has the opportunity to learn a little bit more. It has our virtual tour video that's in there as well. I thought I'd throw that one in there since we're on a Scholar Track panel here today. But in addition to that, visiting campus, so critical, getting the opportunity to do an individualized tour led by our student ambassadors. Call them Southern ambassadors here at Florida Southern. You might even run into Moxie. He's our mascot. He is a snake, not a shoe, because it's the moccasins here at Florida Southern. I will share, as part of our tours here, you get to meet with an admissions counselor. If you're looking to tour the nursing facilities or any of our different majors on campus and see those buildings, we offer tours Monday through Friday at 9 a.m. and 1 p.m. We do offer on select Saturdays some of our open house programs, and then our admitted student days for students who apply and get offered to admission to Florida Southern. Our biggest tradition on campus, be a student for a day at Florida Southern, called Southern Select. We host programs throughout the summer as well, and we're even open for holiday tours throughout the Christmas holiday break coming up right before Thanksgiving. So if you're visiting grandma, grandpa, friends, family, aunts, uncles, want to visit the beaches and the theme parks in Florida, stop by Florida Southern. We'd love to show you around campus too.
Thank you for that wonderful presentation. Let's go to the University of Iowa.
Is it bad if I say ditto? But yeah, no, I mean,
That works. Yeah.
we all have our
I'll be
online
equally
resources.
as complimentary.
Yeah, I mean, there's only so many ways that we could say go online, but go online. And then I guess something fun is I'm your person. So if you're coming to the University of Iowa or interested in Iowa and you want to talk to somebody specifically, I will be your person. And my information will also be online through the Scholar Trek's virtual College Fair booth as well.
Perfect. Thank you so much. And let's go to Mercer.
Last but not least, so
Absolutely.
with us, you can find us at visit.mercer.edu. You can find a blend of virtual and on-campus in-person experiences to check out the campus. And they range from dip a toe, spend a portion of your day with us, to spend your full day. And in the spring, for our admitted seniors, we do have our very important Bear VIB tours. So that is where you're able to customize your day and be able to have an in-depth look at what it's like to be a Mercer student, and follow us on our Instagram. That's a great way to learn more information there too.
All right, thank you. As we wrap up, I'd just like each of you to share maybe anything that you didn't get a chance to share with us today in the panel, and offer one piece of advice about the admission and college search process. And we'll start with Florida Southern.
One quick thing that I didn't mention at any point in time for us, it's free to apply. So it's very high risk, low reward, or high reward, low risk for any student. If you're interested in Florida Southern, it's a great opportunity if you're adding us to list that's there. And my one piece of advice, and I touched on this briefly, is we are admissions counselors. We're not gatekeepers or deny makers that's out there. I like to say we're here to help you throughout the admissions and application process and want to answer questions, get you in the right spot, really make sure that you're achieving your goals and objectives as a student, parent, a guardian, an advocate, a representative, whatever it may be. Use this as a resource as you're going through your college search. We say that a lot, but we really try to be very friendly, welcoming people. That's part of our cornerstone at Florida Southern. No matter your background, no matter what you believe, no matter where you come from, you're welcome here.
Thank you very much. All right, University of Iowa.
All right, I guess one last thing about the university is I do want to encourage students who are coming for a full college experience that the University of Iowa offers so much. While it is difficult to double major in an area like nursing, students can still continue to be engaged in other activities. For example, we have music for non-majors, and we have dance, and we have creative writing. We have a vibrant writing community. So a lot of our students are coming to Iowa. They want to be a part of that. They want to be engaged in the discovery of new knowledge. So coming to Iowa with an open mind and the ability to be involved in more than what you're comfortable with is important. And since we're talking to Georgia and Florida students, it is snowing right now. So I would like you to be prepared for all 4 seasons, sometimes in a day. So that's something that you need to be aware. If it snows 6 inches, you're going to school in the morning, it's going to be fine. You'll be really cold, just wear a lot of layers. So those are some fun things to think about. My biggest piece of advice, I think that it's pretty much already been talked about, but definitely try to engage with the school somehow. Make a phone call to the admissions counselor, call one of us, go online, listen to a student panel, check out social media. There's a lot of really cool things out there on Instagram or YouTube, or I don't even know them all, but just go out and try to find try to learn more, because we can only tell you one little snapshot and there's so much more to our story. So good luck.
All right, thank you very much. Mercer University.
I would encourage, look for the place that feels like home for you and ask questions to understand what that means for you. So each student has a different path and a different process, but we're all here to give you those resources so that you feel excited and confident about whatever that next chapter looks like for you.
Thank you very much. And last but not least, the University of San Francisco.
Yeah, and one thing that I always love to share for all of our senior students, congratulations. You've made it to your final year of high school. Huge, huge accomplishment. Enjoy the rest of it as much as you can, because you will never be in high school again, right? Something else I will say is those emails from all those colleges will eventually stop coming to you, right? But really try to enjoy this process and find this, enjoy the college search process, right? All of this energy and all of this effort you're putting into looking, it will come to fruition eventually. Those emails will stop, but enjoy it. I wish I get emails from colleges now to boost up my ego a little bit, but it will be over before you know it. But really, really try to take a breath and just enjoy the process.
All right. Well, thank you all. That was great advice. And thank you so much for sharing so much valuable information. Viewers, thank you for watching. Don't forget to visit these colleges' virtual booths and connect and learn more. We encourage you to take advantage of the other college panels, workshops, and virtual booths found within Basecamp. And thank you on behalf of the Scholar Track team for tuning in with us today.